The title is How to Use Choi Implanters and Place 1600 grafts per hour in Hair Transplantation. Hello, I am Daeyoung Kim from Seoul, Korea.
Jung-gi Paek, a former Hansen's disease patient and paramedic in the Hansen's disease isolation camp, developed a hair implanter for the restoration of eyebrows in 1969. Since then, he has performed over 3,000 cases of eyebrow restoration surgery on Hansen's disease patients. Y.C. Choi modified the implanter and introduced a new equipment to the hair transplant world in 1985. In 2000, several companies modified the Choi implanters so that they could replace the needles. In this video, I'm going to discuss the benefits of using Choi implanter. Before we look at my technique, let's see the proper method for replacing the needles of the implanters. First, hold the implanter with the needle pointing away from you and the clip opening facing you to prevent injury. Place your index finger behind the clip to prevent the clip from flying away. Push the clip down gently with both thumbs. Turn the cap counterclockwise. When the cap is down and the pushing rod is out, you can pull out the needle and replace it. After replacing the needle, return the pushing rod and put the cap back on. Line up the hole in the bottom of the needle with the body of the implanter and replace the clip. Choi implanters are available in various sizes and colors. The color indicates the diameter of the needles. Now, let's have a look at my method for using Choi implanters. Using forceps, pick up a graft at the hair shaft to prevent damage to the graft. We place the graft in the slit of the needle with the hair shaft pointing downward and the hair follicle pointing upward. The graft is then slid into the lumen of the needle. I'm making a hairline with 20 one-hair implanters. I start out with 14 loaded implanters in my left hand, and I pass them one by one to my right hand to insert the grafts. The emptied implanters remain in my right hand until there are 7, at which point I pass them to the technicians to be reloaded. This is because 7 is the maximum I can hold while still placing grafts with my right hand. This technique reduces the necessary hand movements. When I'm making a hairline with the one-hair implanter, I allow more space between grafts, and I start from the front and work toward the back. This gives the implanted hair follicles time for clot formation and site adhesion. More grafts are later added in between to increase the density. For graft implantation, there are 2 steps: recipient incision and graft placement. These can be combined in one step using the Choi implanters. After being loaded, the implanters are put in a sponge can filled with cold saline solution, where soaking prevents the grafts from drying up. Pads are placed on the bottom and inner wall of the can to prevent blunting of the implanter needles. Focus on the magnified visual field and place 14 to 20 grafts in rapid succession. Severe popping is rarely seen with this method, happening in only 1 to 2 cases per year. With this technique, more than 1,600 grafts can be inserted in an hour, with the assistance of 5 technicians circulating 60 hair implanters, 21 hair implanters, 32 hair implanters, and 10 3-hair implanters. I control the angle of insertion to be the same as the pre-existing thin hair. In an interview with Jimenez, who was the co-editor of the International Society of Hair Restoration Surgery Forum, I answered some questions about the Choi implanter technique. He asked me the biggest disadvantage of this method. I have used this method for 10 years, and the biggest disadvantage is that the technique requires 5 technicians and 45 hair implanters on average to keep the speed. Jimenez also asked why 90% of hair transplant surgeons, especially in Western countries, still prefer manual forceps for planting, when my method is so fast and easy. I think the lack of popularity in Western countries is because of Unger's textbook, in which doctors Minotakis and Shapiro said that they spent 4 to 5 hours placing 2,000 grafts using Choi implanters. However, they worked with only 2 loaders, and obviously this is why their speed was much slower. So I think the main reason for not being popular in Western countries is that hair surgeons using Choi implanters had to work a longer time. When using the forceps technique, most surgeons just make the slits, while their skilled technicians place the grafts. However, as seen in the video, I can place 160 grafts in 6 minutes, reaching a speed of 1,600 grafts per hour. 3,200 grafts can be inserted in 2 hours with the assistance of 5 technicians circulating 60 hair implanters. The operation was started at 8 a.m. and was finished by 1 p.m. The transplantation of 3,200 grafts was done successfully with just a 5-hour operation. Once placement is completed, we check and adjust the depth of the grafts using the jeweler's forceps. Photos of the patient in the video before and 6 months after surgery. Thank you, and I hope you consider the benefits of using Choi implanters in your own practice. Thank you for your attention.